Good evening, dear viewers, and welcome to another episode of Health Link, brought to you in the studios of QTV by myself, your host, Dr. Shamila Jah, and my co-host, Dr. Masarindin Jai. Following on from our conversation that we had last week on the easing of the public health and social measures and what is happening across the globe, we will continue today with two other guests. But before we do that, just wanted to give you guys an update that of COVID-19 in the world. As of today, a total of 7.6 million confirmed cases of COVID-19 have been reported across the world. And the numbers, these numbers, like we said before, they are the ones that have been reported formally to WHO. So the numbers on the ground is likely even to be more than that. In the neighboring country, also in Senegal, the cases of COVID-19 that have been detected every day still continues to be high. And in the Gambia, therefore, there is no room for complacency. However, like what is happening across the world as well, we also need to familiarize ourselves with how we are going to move forward with this virus and live what we are calling now the new normal. So we will be discussing more on this and how the messages to you out there in the public and what that means to you going forward. So I'll hand you over to my co-host, Dr. Ndiaye, to continue in Wolof Mandinka.
Assalamu alaikum badin lamar lalu bal kontonna bismillah na programme do mami health linkti men kanale QTV tenamo tenan bi nakacha be continue men na wala nyin coronavirus men nabe nyoka hani sai me continue la wala kachala bawo nala juwe man sakunda pudul yom fandile pour molse la balwol keno baro matin nako kafo ko sasa nyin bandale o kamala ne dunia jube bi men siata mo million wara wulati wala nyin sasa soto sainte mbalaja même Sénégal ti me ala wala ben dol balajam mome ya soto yesa asiata mo wuli jeluti o kamala gamma ndol mayina sila ngambulula nyoka ngafo ko ni sasa bandale wa ne ajube hani Gambia fango bi me tembo mento me ya soto ngomo tansaba o ya soto bi o to ya tandiko sasa nyi mu fenati me ya lonko manya na kambulula nyoka ko ngafo ko bandale me nyoma ko la me kacha dilala me ya lonko men nyanda kala ron pour que man fantanka me continuer wala kacha kono ala barka baat suñ mbokki déglukat yi ñu ngi la bismillah suñ programme bi te mooy Health Link bu dee ñëw QTV lundi bu nekk te moom comme ni ñu ko waxee rek dañu mën a continuer suñ programme bi coronavirus infection bi bu nekk si aduna bi soo leen ko bàyyee xel fi ñu nekk si aduna bi léegi lu ëppa juróom-ñaari million ñoo am feebar bi fu ñu nekk loo xam ne loolu lañ xam ñuñ xamul ñoon kenn xamul loolu si kaw lu soo xoolee Sénégal moo xam ne ñoo nekk suñ niveau yi upana ñaata junni nit ñoo ko am foofu so si kaw loolu Gambia duñ mën a toog ñu ne ñun moom feebar bi comme kay bay tey fu ñu nekk ni 30 people ñoo ko am si Gambia fii so ñu mën a toog ñu ne feebar bi jeex na de fekk mu ngi Sénégal te loolu urut so si kaw loolu nañ waxtaan si ñu seet naka la ñoo dimbalee suñu boppa pour aar suñu boppa si feebar bi jërëjëf.
Thank you very much, Dr. Ndiaye. So in the studios here we have someone that everybody is familiar with. He's Dr. Desta Turini, the WHO country representative. Dr. Desta, welcome.
Thank you.
Again.
Thank you very much.
So from last week we were discussing this new normal and how we should be going forward, be very cautious with the preventive measures that we have been talking about from the very beginning. So we wanted to also bring you here so that we can hear from you also your views going forward with the pandemic in the Gambia. What your advice is for the general public at this particular point in time.
Thank you very much, first of all, for inviting me. As usual, I'm very glad to be here and share my views to the public. You are right, the relaxation of some of the restrictions comes as a result of, the needs from different perspectives. the health perspective, the health aspect is important, but at the same time, people have to also make a living out of different economic activities, particularly in Africa. Most of low-income earners are actually have to work every day, either in the market or in small shops or in a petty trade, to get some earning to support their families. So it's not easy to pass through this type of restrictions because of COVID-19. We have never seen it before. So the government has evaluated the situation and has come up with some scaling down of some of the restrictions to allow the public to function a little bit more openly. But still, most of the restrictions that we have put in place are still in place, apart from some relaxation in church, mosques, and schools, and most of the restrictions regarding public gathering and other aspects remain the same. And one important thing that we have to note is when the relaxation is made on some of the measures, it does not mean that the game is over. There is no more COVID-19 in the Gambia. We have Senegal, which is surrounding us completely. And practically, we are two countries, but in one country. So whatever happens in Senegal affects Gambia. And Gambia is daily reporting about 140, sometimes even, Senegal is reporting every day new 140 or more cases every day. So that shows us that there are many people with COVID-19 in the Senegal. And as you know, the borders between Senegal and Gambia are just like there is no border. People cross at every point. So people who are infected are getting from Senegal to Gambia. People transport goods, and some people are also crossing both sides of the border, and that's not good. That brings also some of the COVID-19 cases into the Gambia, so we have to be vigilant. People have to really do the necessary precautions. One, the distancing is the most effective measure to prevent COVID-19. You have to keep a distance, 1 meter or more. The farthest, the better. You have to always keep distance. But what we are seeing now in public is many people are actually thinking it seems that it's over. And I see in the beach they are full. People are playing and mixing with each other very freely. That's very dangerous and very disastrous. If the disease happens to be in one of them, it can easily spread. So this is the hand washing, hygiene should be kept also going on. And wherever you are with in public gathering, you have to keep your distance. And the masks have been also advised by government to be worn by the public in public places. Please use masks because it will prevent the spread of COVID-19 from those who are infected to the uninfected people. So if we do this and use the usual precautions, not touching eyes, mouth and nose, and keeping the hands always clean and keeping the distance, when you have symptoms, report it. Call the toll-free number. Don't go to the health facility. Call the toll-free number and get tested. And if you do that, I think this will actually keep us going much more safer. That's what I would say.
Thank you very much. It's very important information. So while we are going about our normal businesses and other things that we need to make a living, and also and things like even going for religious, for prayers or even to school, we have to make sure that everything that has been said from the very beginning, we still continue to practice that. We'll be opening the lines very shortly. So, but before we do that, I'll hand over to my colleague, Dr. Njai, to convey the message to our viewers.
Mali mulu kome nga fala nyame na kachakono adun tamba soto jamme keta WHO representative foti jang wala dunia la kafuba même marta jati kende ala membe siriya banko kanjang wala bales jam bi nga ñinin kanu menna walen sayenteng bawo sasal fele dunia ba fala ko molbe ko talakan ne mais mune je na gambel ko wala ñinti ko ala jabiro katamenti wala ñinde mbe damenten gamben ta sino la ngam bulula nyoka nga foko sasa ñim bantale ako ba ni ajube man sakunda e ko dol talale bawo mol fonga balu fana woto kammala man sakunda be mol bulalale puri la ko dol ke na wala ketan na ala batolti dinno wala kala mun tota anina na ku kotangol men yalon ko ku mata na balu ko man sakunda wol do bula bari na kulliyolu da sanga total anina futu sitolu wol bi je halisa luwa mbelal wol ka wol be larinje woto kammala ka bo kata kafo kono kata fayal ni ku kotangol man sakunda o be tonne halisa me wotem bol to tan pour mo be sa kalam tonya bon ni ajube sain mais Sénégal me alon ko lebe mbala jang luwolu ni ajube ka momen soto kata fo mo keme andu mbaje kan ko mol men falanka dunna nyimbanko ka men ka soto men tembo bento jamal biye ka fo nga nyaade mbot nang Sénégal odo kamala ndol sino ngam bulula nyoka nga fo ko sainteng sa nyi banta jan hani kule menti dunia kono sain mol be men je ka wala nyinti mo mala muntu mala nyimbita nde tuno la suwo kono don fo faw odo kamala fenne me alon ko sain fo nga sonka foko ndabe sabat la jana ko sa dol be nyame bado mayena tinna ngasi ngam bulula nyoka ka foko fonde fana ndefana sa soto non hani do ya soda man fanke wala dite ya soda mine torala odo kamal wala na mo be nyanta min kala wala ke fantanka be fantanka la nyaadi ko nga jam fanyola ba nga fale ko nyin sasa ni ka toto wala ka tisho eta mo le mo ka dila so be fantanka la kana so moy toto kan e kana so moy tisho kan ibo keno la nyaadi wala ye jam fa mol bela ni jam fa da mol la mo te toto le kan mo te tisho le kan fula jam fa nim finda mi da ka foko no wato wati nga masko nyini nga ndal mabo ibaje la ko me ya soto même ma soto nimbe ka masko ta ibaje men ya soto ta dina nyindol la men man asoto foto kamale nen ta ka foko no wata nga tra nga jam fan molla nga fankanda masko la alina bulukol me nga fo nga continue wala won mu fennete me alon ko ba tra la pour ka tankanyi sasa ni ngol ke jama ala men di mala le pour nga tankanyi sasa ala baraka bak.
Thank you very much, Dr. Njai. Dr. Desta, you touched on something very important, which is that if you have symptoms and please call the toll-free number. This is, I think, is even more important now that you mentioned in Senegal we are having many cases that have been reported every day. This brings to light the issue of testing. While we are in this thinking of easing our restrictions, what is your view on laboratory testing?
Yeah, laboratory testing is very, very important. Currently, most of the tests are done among people who just happen to be, crossing the border, and they're kept in quarantine. And most of these the people who are getting tested. But we need to test more people from the public, particularly those who are coming to health facilities with symptoms like fever, cough. They should get tested. Even if you have sore throat, you have to get tested. It's good for you, it's good for your family, it's good for your community. If you don't get tested, what happens is, even if you don't, nothing happens to you, you will be transmitting the disease to all your family members, and then I think some of the people that are infected may just have a serious illness that might be not easy to contain and control. And the other thing is that
I just want to take a second to inform our viewers that, dear viewers, please call the number on the screen, 50500505. Thank you. Yes, please, Dr. Desta.
Yeah, the other thing is also, those of you who are living close to the borders, when you have visitors from the Senegal, please advise them to report to the nearby the health authorities, so that they can really be screened, and you can protect also your family and yourselves from possible COVID-19 cases, because sometimes some people may get infected but may not show symptoms up to 2 days, and after 2 days they may show symptoms, and some may not even show any symptom for a long time and may not show it at all also. So just by not seeing a person sick, it does not mean that person is not having the virus. But if this person comes into contact, particularly with those above 60 years, and those who are having hypertension, diabetes, and those chronic illnesses, then if those people get the infection, they may just he will develop very severe illness that might be difficult to manage and may even endanger their lives. So it's very, very important that we keep vigilant and be open about this. When people come, it's not about accusing them. It's just a disease like any other disease. Let's not allow it to get transmitted in the community by keeping quiet.
Okay, we have a caller. Hello, caller.
Hello, good evening.
Good evening.
Yeah, I'm calling from Farafeni.
Yes.
Hello.
Yes.
Hello, yes, we can hear you.
Yes, yeah. Thank you so much for the program, of course. I've been always following it up. Yeah, I'm getting you. As I said, I'm calling from Farafeni, and I'm always following up. Even last week, I was following up your program. You've been doing very well and everything. Coming to, without wasting much time, coming to what the doctor mentioned now about the mask, using the mask, or people are not taking the pandemic very serious. That is true, because even in Farafeni here, the market, I don't know whether the policemen are tired of enforcing the using the mask or what in the social distance or whatever. What I want to say, is it correct? My question here is it not proper? Don't you think it's proper for government to make it compulsory for the use of the face of the mask, because in order to minimize, to cut down or reduce the transmission? Because when they leave it optional like that, people are not serious with it. I think in this time now, I'm expecting that the government should really emphasize on that, so that it is spread. And then secondly, coming to the divisional health teams in the provinces, because they are receiving people from crossing the border coming up and some to go to quarantine. And when you get there, they are complaining, though the health workers are complaining that they do not have all that they need to keep these people going at the quarantine center. So I'm appealing if they can make everything possible for them so that they can get all the necessary logistics to keep these people going in their feeding and everything. I think that would be very good. Thank you very much.
Thank you.
Thank you so much for your question. So the first one about the mask, I think it's something that the government is. I'm sure they are also looking at that, and in due course they will issue something. What is your opinion on that, Dr. Njai?
At this moment, the government is advising everybody. So it has not come to a point where you have to force people or even charge them for not doing that.
Exactly.
But when the worst comes to the worst, that has to happen. But for now, the advice is to make sure that everybody test masks everywhere you are going.
Yeah, but the other thing also, just to complement that response, is that masks are actually advised. Everybody, it's to your benefits if you wear a mask. That's what the advice is. But if you cannot wear a mask, and if you don't have access or you cannot afford to buy the masks, at least you can even cover it with a scarf or any clothing material that you wear around your neck. If your mouth and nose are covered, particularly if you are coughing or when you are speaking, particularly when people are around you, it will actually help. It will be like a mask. The other thing that we need to also pay attention about masks is also, when you are using masks also, there are certain things that you have to be very careful about. Particularly if you are touching it regularly, you are touching other things and then you pull your mask down and up, that's also dangerous because it will actually attract a lot of contaminated things into your respiratory system. So all that has to be taken care. Mask by itself is not a solution. Masks should be used with clean hands when you wear it, and when you remove it, your hands should be washed with sand and water, or soap and water always. And you should never touch your mask once you wear it. When you want to remove it, you have to wash your hands before, because you will be touching other things in the meantime. So when you remove it, you have to keep your hands clean also. So it's not easy to use only mask, may not be a solution, but it goes with all the other measures that we mentioned, the distancing, the hand washing, not touching the face, and particularly eyes, nose, and mouth. These are all very important. And when you are feeling sick, also reporting immediately. All these are important. If you are sick, you shouldn't go even to the public first of all. Once you have symptoms, you have to report it and you have to get attention. So it's a lot of responsibility. This fight is everybody's fight.
Everybody,
it's
yes.
not government, it's
Exactly.
not every individual should
Indeed.
also
Indeed.
pay their own dues also to contain this spread of the disease.
Indeed, indeed, indeed. And the other thing also that he talked about, the logistic part of it for
The
quarantine.
RIDs, yeah.
Yes, I think that is also something the ministry already has a plan, and it's something that is been discussed. So I'm sure that will be also addressed quickly. Dr. Dessa, just also for easing the restriction, we've seen in other countries a phased approach. That is, what is WHO's? What is your opinion on that?
Okay, when governments are actually introducing or scaling down some of the restrictions, there is a guidance from WHO. The WHO guidance takes into account 3 aspects. One is actually how much have you controlled the spread of the disease. Are you not, if you are reducing the number of cases significantly, and if you have done, provided that you have done proper testing, good coverage of testing, then it shows that it's declining, then there is a reason maybe to relax a little bit. But when you are relaxing, it should be a phased approach, meaning that you relax a little bit and see how it goes, and for 14 to 2 to 3 weeks you observe it and you assess how the trend is. If the trend is going down, again you further can relax a little bit some of the measures that you put in place, and if things are going well, then you can even further scale down gradually. And if the situation gets worse also, you can go again to tightening some of the restrictions as before, phase by phase, depending on how well you are containing the spread of the disease. The other aspect that you have to see also is, apart from containing the disease, is how much capacity do I have to take care of people who may get seriously sick and need admission? Do I have enough beds? Do I have enough intensive care facilities to take care of those who are falling sick? That has to be taken, and you have to really gauge that carefully. The other aspect is your surveillance system, meaning that how quickly can you pick those who are having infection and diagnose them and then isolate them so that they don't infect others. If all these 3 aspects are doing well, then you have very good measure in place, and then you can scale down and scale up depending on the situation, based on your assessment, regular assessment. Every 2 weeks, 3 weeks, you assess the situation and then you go either up or down in scaling the measures.
Yes, this is similar to what Mr. Senghor was saying the last time as
exactly. You
well,
have to
that
look
you
at
know,
the
if
impact
exactly that
for
if we have,
humanity.
we will go back to, yeah, that's what he was saying as well last time. Maybe you can translate this very important message.
suñ mbokki déglukat yi comme ni ñu ko waxee tey suñ gan bi mooy WHO representative fii waxtaan bi ñu ngi ko dooree woon si affaire testing bi si dëkk bi lu mu doon wax rek mooy dañu war a yokk test bi léegi fu ñu nekk nii soo xoolee soo ko bàyyi xel ñu bari ñu dee test mooy ñoo xam ne dañ jógee feneen ñëw si dëkk bi waaye dañu war a yokk test bi parce que soo ko yokkee di nga xam ñaata nit ñoo ko am si dëkk bi so mu ngi ñaan nit yi yëpp koo xam ne yaa ngi am feebar comme yaa ngi gis ne yaa ngi saxat sa yaram baa ngi tànga yaa ngi am sutru trial nga call 1025 pour ñu test la parce que suñ la ko testé yow sa boppa la ñëw dimbale ak sa njaboot bi parce que yow mun ngaa am feebar bi du la sonal dëgg la waaye mun nga koo wàlla keneen koo xam ne kooku dina si sona ba ñaaka si bakkeen te buggulu loolu so moo tax luñ mën a def rek mooy ku nekk pour aar sa boppa ak sa njaboot bi pour nga try nga dem test su amee feebar rek nga try nga dem test sa boppa si lopitaan bi ñu ngi waxtaan tamit ñu seet restriction si comme lu nguur gi def nii léegi pour wàññi yeena yi mooy léegi fu ñu nekk ni mun nañoo dem suñ jumaa bi suñ cooji xale ñun mun nañoo dem school mu ngi wax loolu ne dëkk bu nekk WHO dafa am guidance boo xam ne mooy dimbali nit yi pour ñu seet naka la ñoo wàññee seen restriction si dëkk bu nekk loolu naka la moo demee mooy force te ñoo seet ñaata nit nga test yow te ñaata nit ñoo si feebar ak naka la namba bi dee demee mooy ne mbaa ñu nekk feebar ndax namba bi mu ngi wàññeeku na mu ngi yokku soo si kaw loolu mun ngaa seet nga ne ok xaaral ma wàññi yi parce que fu ñu nekk ñu am feebar bi mu ngi wàññeeku mun ngaa jël loolu wala nga seet nag léegi yow mbaa am nga capacité bi te léegi su ma bàyyee yëpp léegi yàlla tere su nekkee ne nit yu bëri feebar nañ léegi fan la la yóbbu soo su nekkee yaa ngi am loolu yëpp mun nga ñoo seet ñu wàññi waaye si wàññi boobu sax di nga ne gis ne léegi-léegi nga wàññi affaire yi nga toog le ñu bëri am fa nga delluwaat nga tëj yéen yi so noonu lañ dee mën a def pour wàññi restrictions yi so si kaw loolu Gambia fu ñu nekk ni soo ko bàyyi xel time mu ñu doon wàññi affaire ñu ngi yoon wax 3 cases léegi fu ñu nekk ñu ngi wax ba 5 cases tey so dangaa gis ne léegi fu ñu nekk ni ñun duñ mën a toog ñu ne war nañoo ubbi yëpp loolu du suñ ko defee lu baax si ñun waaw.
Thank you so much. So Dr. Desta, thank you so much also for coming on the show. What is your parting words to the viewers? Your message?
The message is, COVID-19 is not yet over. We are still in the middle of COVID-19. Gambia is yet to scale up its testing. We are not testing enough, and the government is preparing with partners support ourselves with from WHO. We'll be supporting also government to expand the testing services to cover most of the places, including all the regions of the country, so that we see exactly what we see currently, whether it's true reflection of the reality, whether we have some cases that we have not picked or not. So that will tell us what is going to happen. But from what we suspect, what is happening in Senegal might also have some reflection in the Gambia, even though it may not as high the number that we see in Senegal. We must have some cases that we are not picking inside Gambia. So we have cases in the community, and we have people coming from Senegal and going back and forth. So we cannot be really anticipating that a miracle that we are not touched. So maybe we are not picking. So this is the situation we are in. So be careful. It's not yet over. What I am seeing in the streets, and particularly the youth, is very frightening. People have started playing soccer, coming together. It's very dangerous. This is where actually we allow the disease to spread very easily. So my appeal is actually for parents and even the youth and everybody to really act responsibly. Keep your distance wherever you are going. Keep the size of the gathering to the minimum of 10. I think this has not changed. Wherever there is a gathering, a maximum of 10 people is allowed. And even within 10, keep your distance. Wash your hands as frequently as possible. Don't touch your face, mouth, and nose. These are, proven measures that will protect you and your beloved ones from the disease. So keep safe, take responsibility.
Thank you so much, Dr. Desta. So dear viewers, we'll be back very shortly with another guest. Welcome back, dear viewers. So we have in the studio, like I said, we have another guest, and he's also someone very familiar to all of you. He is Dr. Mustapha Biteye, the Acting Director of Health Services, and he, like we mentioned before, he's really the action man and the one in charge of the COVID-19 response in the country. Dr. Biteye, you're welcome.
Oh, thank you very much.
So, dear viewers, please, the lines are open, so please feel free to call us 5050505. We're talking about easing the restrictions and how we should all, the precautions we should take moving forward. Dr. Biteye, just before the break, Dr. Desta was talking about laboratory testing, especially in that we are easing the restrictions. What is your take on that, and what plans do you have?
So thank you very much. I think just to say before that we are very happy this week because, as you know, we just launched our laboratory. Dr. Desta was there with the Minister and MRC and many others. So now we are doing the testing in our own place.
Wow.
And that's a big achievement.
Indeed,
But
indeed.
and more to that is also we are planning on doing more targeted testing. So right now we are in the containment stage, and we are lucky to be able to maintain it for a long time. So anytime we get someone who is positive, we quickly just go and take your people and people you've contact with, and then take them to the quarantine facility. So we are able to mop all the people that have contacts. So now we are trying to go to areas that we think they are potential identified areas, and we see how we can test a big number of people.
Okay.
And then I will start maybe from Banjul and gradually go around the country.
The country. Okay. Okay. So that's very good news. But then you may end up, Dr. Njai also he's the one he's doing a lot of good work as well in the sanatorium.
Yeah.
So we hope that you will not have new cases. Yes.
Yes.
Yeah. Maybe that's also something you want to translate to the viewers.
bari mon na lamor lalu bal be kontan na programme mo mbita kan na lundam flanyo wala Dr. Mustafa Biteti mo director of health service di tembo mento. So comme nga fanya me ni jubero ni testo me mem fo kante mbole ko kachaka anda nyim foko sayeng ba man sakunda fon ka jube wato ngadi MRT la ka nyoma ko pour kake bal sayeng palanganta yelele kutu me alon ko man sakunda fon ba keka o kamala sayeng ba wolte sayeng dimanche doku je saturday de CBDT je ka bele doku so be testo dat la banko be kam pour ka jube dulal men yalon ko ase fenkanoje pour kata ka mol jube ni ala sonte barat la mebe ko brikama kaji kata do mandi fo banko be ka be kova be baaj la ko tamo balon na mo nan ko mo jella soto jang aning bitaka nyaade ni ajube sainteng atara fo wat lokon sita me alon ko man kes jama soto bawo ni ajube lokon fla ko mandun tala kes sabada malbe nunje bimbe damembe lulu oto kammala safo don fulada mal la fata je ni ajube o kammala ko bitaka anomal anyamale folo bari fonga la fanga testing ke ko banko dol ba ke kanya o time wala balon na me tembel malto.
Thank you, Dr. Njai. We actually going to have a caller. Hello, caller.
Hello, assalamu alaikum.
Alaikum
salam.
Ibe kairata.
Kairatro.
Kortanante.
Tanante.
Iyo, ntelam debe mparmata sola me man sa konko.
Bansa kongo okay.
Ha ade alla programu dia tanyi bake.
Abaraka.
E bari ntem fulolati. Ko tem fulolati.
Asa.
Ha bari alla programu wati ka jubila bari alla programu albuka fulaka mo albuka fulol pana invite.
Okay, me flow invite la ko rek.
No, time lafta fulol pana yetaraje.
Okay.
Alla programu ka dia bake kala moyle.
Inshallah. Abaraka ba.
Bari fulol pana yetaraje. Thank you very much.
Welcome.
Thank you.
Okay.
Yeah, she can speak Mandinka, isn't it?
Yes,
Yeah, so there's always some.
for us also to hear.
Yes.
So we will look into that.
Okay. So Dr. Bithe, what plans do you have, like in terms of easing the restrictions? We've seen already in the mosques can be open, the churches can be open at least once a week, and the schools also, particularly grade 9. Will there be other things that will be considered, and how is it going to be done, just for the public to be aware?
Yeah, I think the plan is that we are surprised. What the announcement is for us to ease slowly,
Okay.
and then you assess.
Okay.
So the way you are easing and you are assessing periodically and seeing whether there is improvement. Like for example, after 2 weeks, if we assess again and see that the number of cases are big, so we may go back to where we were, so that we
Okay.
yeah. So, but what we were saying that okay, let's open the mosque for Fridays, let's open the churches for Sunday. But people took it to mean you open everything, and it's not
Yes.
like that.
Yes,
And there are
yes.
lot of guidelines that the presidency brought out
Yes.
before you even open your mosque. And we are very happy to note that some mosques, even because they did not have all that, they did not open.
Wow.
They waited till the following Friday. Some people are really following the regulations and they understand. There are some churches also, or most churches I may say, did not even open because they did not have all the things required, so they
Yes.
decided to wait till the following Sunday. But you see, there was a mosque I went to pray. I had to even sit down, and because I went there after the first rakah, so I had to observe social distancing. But when we finished the second rakah, I had to meet the imam and everyone and talk to them. Because what was done was not really what is expected. So if we do this and then we assess and we find out that the cases are going higher and higher, then we will go back to probably advise for a lockdown or something like that. And I don't think we should do that. So people should observe so that we continue to have the gains and gradually ease more and more.
Yeah, it's a very, very important message, Dr. Njie. I think you should help us.
Comme suñ mbokk yi déglukat yi comme ni ñu ko waxee rek suñ beneen gan bi mooy Dr. Moustapha Biteh mooy Director of Health Service. Ni ñu ko doon wax mooy affaire yi social restrictions yu ñoo wax nii nu government bàyyi léegi nii. So da ngaa gis ne luñ mën a def comme lu mu ko waxee rek fu ñu nekk nii doo mën a toog rek nga ubbi yëpp nga bàyyi yëpp nit yi ñu ne ku nekk di def lu la ne foog ñu def kon ndànk-ndànk ñu seet. So da ngaa gis ne léegi government lu ñu waxoon mooy ne comme juma bi léegi mun nañoo julli Friday juma mun nañoo dem si church yi waaye da ngaa gis ne waxuñ ne léegi ñu ubbi ko comme ni ñu ko nekkee woon comme 5 daily prayer bu ñu fa dee def loolu. So waaye da ngaa gis ne ñeneen ñi soo demee foofu waaye bu ñu waxee ne ñu ubbi ko pour Friday ñoom ñu ngi ubbi rek julli naka ni ñu ko buggee. So da ngaa gis ne loolu def ñoo sonal. You have a caller?
We have a caller. Hello, caller.
Yes, hello.
Hello.
Hello, I'm getting you. How are you?
Fine.
Okay, this is Khadija. I'm calling from Lamen.
Okay, you're welcome.
Okay, I just want to appreciate all the support the frontline health workers have been doing during this COVID-19.
Thank you.
Thank you.
We really appreciated your job.
Thank you.
Thank you.
You've been there for the whole day. You don't spend your time with your family, but you are making sure that the Gambia is safe from this COVID-19, and which we have seen.
Thank you, ma'am.
So honestly, I am really grateful to you, especially to Dr. Biteh, Dr. Masereninja. I know you all, and you people are the best. With Minister Samade, may God bless you all.
Amen.
Happy.
Really appreciate
all
it.
different health workers. And I'm sure if Gambians cooperate, we will fight, all of us will fight and get through this COVID-19.
Inshallah.
Let's just take something, and then we practice the social distancing. It's very important. As the doctor will say, in the mosques, in the churches, I think people have to try and then do that. Then if we do that, then we will all overcome this COVID-19. I'm pretty sure of that.
Thank you very much.
Thank
really
you so much.
appreciate it.
Yes, thank you.
I just hope everybody feel the way she is feeling and then express it.
Exactly. And you will agree, this is what Dr. Biteh said is exactly what is happening outside. Everybody is out now.
Exactly.
So it's very important that maybe you should continue with the message. Yes.
Comme men kacha kan don bali ngolo wala nyinti me mola ja kolel fo kan sai men be keri ba man sakunda kabri kol yom fandi wala nyinti ko stano jumol salinole stano na chojol tole dinno stano karambu tole bali ma foko sai mole jamol be la diata nyame so mandati bla wala molbi anim fula nyom fana nin tata je ko ni janal be dunanga bloku bunna da fay sen nin tata nga sabanyola do manni o be mako la bakel bali bali ni tata bla dolto e baje la ko molbe ko beke ke bloku kanale ke dunga diata nyame yendo wakete nyame ye tenta ye o keta fene de me alon ko aman koy ba nga memmira wala nyinti ko ni nga nyin ko talado manni ni nga jibe folo ko fula nga je ko be nafakan ne manki dol soto no ko rek e sa se ko de man tala bal sa alman tankale ni sita fonda nga mo kes mo kes talul soto ko rek fo nga murun no to abenu nyame so to ta fenne de me alon ko be molbe danila man sakunda ala ni nyame nga bula anoma nyama ni nga kele wato le abe mbe mako.
So Dr. Biteh, just like we have another caller. Hello, caller.
Yes, Mbakam.
Seems we have lost the caller. Yeah. So regarding the laboratory testing, in the Gambia, like you said, that we need to expand and we need to have in other places as well. What currently do people need to know in the other regions where we're not going to be having the targeted testing? Do they have to call 1025, or they have regional teams that they can also have contact that they can call?
Yeah, so I think the 1025, once they call it, it can link them up to that place. But the other thing is within the regions, they have their own teams. Yeah, so even if they call 1025, 1025 will just tell their regions, and their regions will act, so that it will be very fast. And we are also having plans to the nearby facilities within those regions can also take
Dr. Biteye, it seems we have a caller, but this is very important. Hello, caller.
Hello, good evening.
Good evening.
How are you?
Fine.
Yeah, we are fine, thank you.
Very good. We are listening to your program. It's very educative.
Thank you.
Thank you.
Thank you.
But I just wanted if Doctor can elaborate on the two new cases we have.
With 2 new cases.
Okay, which ones?
You know, it was 28. Now we have 30 cases.
Okay, okay.
The 2 last new cases.
It was yesterday, right?
Okay, okay. Okay. I think he's asking about the 2 new cases that were
Yes,
reported yesterday.
Yes.
Yeah. Maybe Dr. Biteye, you can...
Yeah, so I think the 2, one of them is 50 or 50 something. They are all male Gambians. And the other one is 27, I think. And they all returned recently from neighboring countries. And so they were all picked. One, I think, was taken to quarantine on the 10th, the other one on the 11th. And so they were tested and they found to be positive. One was just from the border. He was straight taken to quarantine. He did not have much contact.
All of them were picked from the borders.
Yeah, so
Karang and Jiboro.
Karang and Jiboro. Yeah. So it was really well done. So straight away to the quarantine facility. One was at the quarantine facility in the North Bank.
Yeah, North Bank.
Yes, and so it's really paying dividend, the quarantine facilities we are doing. It's a lot of money, but it is what is helping us to contain the disease up till now.
Indeed.
So, and people have been saying it's a lot of money, but we always say, you know, like what they say about education. If you say education is expensive, try ignorance. Because if you are not preventing it, and you are having to treat them in the ICU and others, one, you have a lot of doctors and nurses, you lose them because they get infected in the process, and 2, you need more resources you know, to take care of patients in the ICU and all that. So I think it's paying dividends.
I think you've answered the question of the caller. Regarding the decentralization of the response, like, you know, so that every region, like you said, I think that is a very it's a big achievement, and I think it's important for the public to be aware that in their respective regions they also have the replication of what happens in the central level at every single region.
Exactly.
And in fact this has been going on for even some time. Okay,
especially
we have a caller.
the hospitals as well.
Yeah. Hello, caller.
Wow.
Hello.
Jama rek.
waaw man ci daa am benn programme moo am léegi nii comme kuy tëdd na muy nelaw di nga tiit si ma di wax la bopp di métti yaram di métti xaw ma luy problème da ngay jëf bi di tiit ne du ma dee nelaw ba fajar so loolu noonu su ma demee xool ne bopp bi métti nga xelaat bi moo bëri so loolu moom daf moo
for now, I think the family health complaint.
Wow, the family health
probably
problem.
Before them lopitan guy check, I think is better.
Wow, wow. I think Mugen Mudem Silopita Mega Muchako, you know, and then, you know, they shouldn't also be afraid. Wow, because of COVID-19 also. I think this is another thing also we have to say.
People are running away.
Yes, maybe you can explain that very well in a message, you know, so that he can understand about that. Yeah.
Comme li nga sa jërëjëf sa call bi, it's very important. Waaye li ñu wax rek mooy su nekkee yaa ngi feel loo xam ne sa yaram bi neexut comme ni ñu ko waxee su nekkee ne yaa ngi sa yaram baa ngi tàng yaa ngi am sore throat kon callal 1025 waaye su nekkul loolu comme noo ko waxee ne doo dee mun a nelaw guddi sa yaram bi di métti mun ngaa leen lopitaan ñu check la so su nekkee ne jar na pour ñu test la pour covid bi lopitaan boo dem rek dañ la mun a dimbale pour ñu test la foofu lañ mun a waaye léegi lu ñoo wax rek mooy ku nekk su nekkee ne yaa ngi am problème da nga dem lopitaan buñ ragal parce que ñeneen fu ñu nekk nii ragal nañ ne soo demee sa boñ bi di métti sax dañoo wax ne covid la ñoo yóbbul te loolu foo naa ne Job Kundaay da loolu rek lañ bañ léegi moo tax ñu dee bëgg a dem lopitaan waaye ñu ngi ñaan yëpp ñu try suñ feebaree rek ñu dem lopitaan ñu gis leen.
Yeah, I think that is very important, especially for the pregnant women and those going for their vaccination.
Exactly.
So really, you need to really emphasize that, especially in Mandinka and Wolof, because, you know, because of the COVID, now they don't come to the facilities.
Exactly.
You know, if they go, they will exercise social distance or physical distancing.
Yes.
They will all that, so they will be prevented. So let them continue to go. Otherwise, they will have complications at home.
Exactly.
And by the
Yeah.
time they reach home, it will be late.
Hello, caller. We have a caller. Hello.
Hello, sister. How are you?
Fine,
ma'am.
thank you.
How is over there?
Alhamdulillah.
Alhamdulillah.
I just have a question to ask about pertaining this COVID-19.
Okay.
Yes.
During the corridor time, people were saying, seeing in Serekunda market, people were too much there.
Mm-hmm.
And then, you know, people were expecting that, you know, after the corridor. So, hello.
Hello, yes, we can hear you. Go
Yeah,
on.
after the corridor, you know, the number of cases of this COVID-19 will be increases, but
Mm-hmm.
we don't see any of that.
Okay.
Until like, you know, 4 or 5 days to the the public emergency
Yes.
finish,
Yes.
we had that they declare another 2 cases.
Mm-hmm.
So I'm asking, how are they conducting their program? So their
Testing.
Testing.
checkup, like
Checking.
test, very good test, yes. So this is my doubt. I say, let me ask.
Thank you very much. Actually, you have, this is a very, very brilliant question. I mean, and you know, it's good that you are bringing this out in the open. So I think what it's talking about is that there was so much mixing during the quarantine,
Yeah,
and
people
then
are afraid
there
and
was
then-
no surge in the cases after that. But then, you know, when this was announced, all of a sudden, you know, we are now seeing the cases. I think you guys already answered
Yes.
it, because you said these cases that we are picking is not from the people in the country per se. It's from those that you are picking from the
borders.
quarantine and the ones that you are testing, because you're doing quarantine, you know, you're really diligently doing that, the quarantine.
quarantine, yeah.
So you might want to add to that so that we can, you know, answer
Yeah,
him.
so I think that, you know, people were saying because of the mixing and the lack of social distancing in the market, which was not good. But after 14 days, maybe when they, you know, that period, people were expecting a lot of cases. But maybe luckily, because the borders were closed and we were taking anybody who was coming in as much as possible, and people are calling. And so we are able to, you know, get most of the people. But it is dangerous. It is a good medium to transmit the disease.
Exactly.
But it is only
Exactly.
dangerous if you had someone there. So we don't know what was happening, but we did. Maybe the reason is there was not much transmission during that period, or people were stopped from coming in. But that is a very dangerous thing to allow people to overcrowd, because if somebody has it, then he will contact so many people, and each one of those will go back to their families. Then by the time you know, it will be very rampant in the country. So that's
think
why
in-
that type of environment should be avoided.
In addition to what you said, like Dr. Desta also said, that we could possibly be having it in the community. But because, you know, people are also not coming forward, like you said, people are worried and they don't want to come to even complain about other things.
Yes.
So they're not coming forward, they're not calling 1025, and so maybe that is even why we're not getting
Yes.
as many cases from locally within the
I think that's
country. What do
where
you want
we-
to add to that?
Yeah, I think that's where he's concerned. Then we need to address that to the public, and he himself with his people. Now,
Yes.
if you ask him how many of your members, family or friends have tested,
Exactly.
now we said 1,000 people have met in Serekunda.
Yes.
But how many of them voluntarily came?
Yes.
Because as of now, testing is not mandatory, it's not a force on anybody. So it's voluntary at this moment if you don't have any symptoms. So how many of them will volunteer to come for testing? By the time you
Even
say
if
them-
they have symptoms, like some of them
Exactly.
can have cough, and they have sore throat,
it's
they don't
going
even
to
come.
be difficult unless and until we have
Yeah.
people voluntarily coming, or it is mandatory on everybody. Apart from what it is still going to be difficult.
Okay. So, Dr. Bite, we have not come into the end of the program. I just wanted you to give us your parting message.
So I think, like what the minister says all the time, you know, people think, I think they misjudge or misread the information. Many people think that there is no COVID in Gambia now, because the government said that, you know, reduce this, let's now have a committee in the mosque. Even if you look at the guideline the government brought out, it is telling you that every mosque, you should identify some people who will enforce it. You will identify some people who will make sure that if somebody has the disease, there's a program they put in place that you will sit down there, then they will call 1025. So there are good measures that are set, and people need to follow that. COVID is not totally out. If you are surrounded by fire,
Exactly.
and you have petrol, all that in your house,
Exactly.
you know, you should only relax after the fire around you is extinguished.
Indeed.
And this is how we should behave as a country. We should all take this COVID very serious until, you know, the whole place around us is calm.
Yeah. So Dr. Njai, maybe you can just summarize quickly because we have very short
Dr. Bite ya fanya men drong même bambali la do wala nyinti ko moli même mira ka foko covid man tra nyimbango ka nyanta ko bonni na ko kono le folo parce que ni ajube ni be siri la bun kono man ningol quand même fo la bun wala jano buka dabo kari so kamala nimbe siri na bungol kono esaso mbalaje dimbabe dan nangol ite mayna tenkuna damante o dimba man fa wala koyta so ndol be nyamen teng damante dandam bankol man tenkun woto gammel manya sila nga bulula nyoka nga foko covid banta nyimbanko kan woto nga kata man sakunda men fo nga bulano ma ba ni ajube hani jamawol men kefo ngo jamao jamang at least nga mo dantan soto je men yalla ko le marna nyin ko ka foko ni mon nata ye buloku ni mon lete sabanyol ni me ye prononcer ya ka toto ya fa ete kete so wolel mu fenti ni nga wol be no madron e ba jela ko be tanko sot la nyin covid tol.
Thank you very much, Dr. Njai. So, dear viewers, we have come to the end of the program. Like you heard from our first speaker, Dr. Desta Tirune, we have to still continue our preventive measures. And just because we are easing doesn't mean that we don't have COVID-19. And this also has been reiterated by Dr. Bitiye. Please, dear viewers, make sure that when you are in the public, practice social distancing. It's a very, very important measure. And of course, all other things, including wearing of mask. So, dear viewers, please keep safe. Would like to thank our crew here for making this possible. Until next time, goodbye.